Hello, everyone. Reflect and Reset with Maria and Gina. Unfortunately, Gina is not able to join me today. Honestly, we are extremely busy with COVID testing. It is amazing what has happened because of the spike in COVID cases. We are experiencing an amazing amount of people coming in to get tested. So Gina had to be at the front line because there's just too many people right now. So I am here solo, but representing us because we are a unit and we support each other. So today in Reflect and Reset with Maria and Gina, we are going to speak about dementia, something that it is extremely important right now. This is a community that is being affected by the coronavirus tremendously. Very sad what is happening to the elderly population that is going through dementia. And for that, we have a special guest, our friend who actually has been here before, Jessica Flores. Jessica is
Hi,
the
Maria.
community engagement manager for the Alzheimer's Association or Society.
Association.
Jessica, Association. So I
Association,
had it
yeah.
right. Jessica, thank you for coming to the show again. You have been in our show before, and we felt that being that November is the month of Alzheimer's, correct? Awareness, that it would be perfect to bring you so that you can talk about the challenges and also some solutions for this community that, could help, especially during next week. We are celebrating Thanksgiving. And so thank you so much, Jessica, for joining us today.
Well, thank you for having me once again, Maria. It's always a pleasure.
Yes, thank you. Jessica, let's talk about some of the major challenges that our community, the community that suffers from dementia, is having during these COVID times.
Right, of course. This is really challenging times for all of us, especially for our caregivers that are taking care of a loved one that has dementia, that has Alzheimer's disease or another type of dementia, whether it is at home or they have their loved one in a facility. It's always challenging because COVID-19 has changed the way that we do everything, right? And so we have to modify what we have already placed in set. And so it's been quite challenging. And a lot of the questions that we have from our caregivers is that if COVID-19 increases the risk of dementia, right? That's a major question in the mind of a lot of people, a lot of our caregivers. And what we would like to say is that dementia does not increase the risk for COVID-19, just like the flu doesn't increase the risk for dementia, right? However, what we want to look at is really at the dementia-related behaviors, right? Dementia-related behaviors, increased age, and common health conditions is what often put people at risk. Because when you have cognitive impairment, it makes it more difficult for people that have dementia and they're living with dementia to self-protect, because a vulnerable person may not understand the risk of the disease or remember to be as careful. And this is really what puts a person with dementia at a higher risk to contract the virus.
What are the different type of dementia? Because I know that you personally, your father had dementia, and
Yeah.
actually at an earlier age. And I know that my mother had Lewy body dementia. So could we start by talking about the different type of dementia that exist?
Of course, definitely. So dementia is really a general term that we use to describe many diseases of the brain, right? So Alzheimer's disease is the most common form of dementia. And yes, my personal experience with it is my father was diagnosed at the age of 63. And when he was diagnosed, he was already probably beginning at the second middle stage of the disease, right? But like you mentioned, we have dementia with Lewy bodies, we have frontal temporal dementia, we have Parkinson's disease, which is a form of dementia as well. And like that, we have hundreds of other dementias, which we can always refer you to our website, alz.org, where you can find all the definition. And we also have webinars that focus on these types of dementia as well.
How can we identify? Here we have the website that has
Mhm.
tons of information. So if you want to get some of the answers even to the questions that we're going to address today, I'm sure you can go into the website and find
Yes,
the information. So what are the type of signs that someone might be experiencing dementia?
so we have developed, the Alzheimer's Association has developed a list of 10 warning signs, right? So we always say that these warning signs are more of a guide for people to follow. They really don't constitute a diagnosis of dementia, right? So we say that anything that's out of the normal for you should be a sign of concern, right? So we often say memory loss is the beginning stages or the beginning signs of Alzheimer's disease, or that something is wrong. And so we're not talking about, the memory loss where we perhaps lose our keys and we don't know where to find them, right? That happens to all of us. However, if you're able to retrace your steps, right, and eventually you find your keys, then I think we're okay, right? That usually happens to all of us. We're talking about memory loss that really affects your life, and it affects it tremendously for simple tasks like perhaps following a recipe or going to a familiar place, or simple tasks like brushing our hair or tying our shoes. If you're finding difficulty with doing things that are simple and routine everyday tasks, that should be a sign of concern. That should be a red flag, right? So anything that's out of the normal, we want you to make a list. If that's something that you're noticing in yourself or in a loved one or in a friend, make a list of these signs, take them to your doctor. We often advise people to grab all the medicine that you're taking, put it in a Ziploc bag, visit your doctor. And sometimes the interaction between two medicines can be causing the symptoms, right? You can be confused. There are oftentimes depression can also be a factor, and other symptoms. It could be thyroid disease, it could be a vitamin deficiency, or it could be another serious disease like a brain tumor, right? So anything that's out of concern, any signs that you're noticing in yourself, go to your primary care physician, take the list of signs and let them know what's happening so that they could do the appropriate test.
Because so the next step, if you go to a primary care physician and they rule out that all of the medication and all the stuff is actually not causing the forgetfulness, that you will see, I guess, a neurologist. Is that the next person that would see you?
Right. So your primary care physician will then refer you. If there's a need, they will refer you to a neurologist or a neuropsychiatrist, depending on the need. So most likely they will look at your medical history. They will run a series of tests. Sometimes they will do a PET scan of the brain, and then they will recommend you to a specialist to follow up on the next steps.
During the COVID times, are you receiving a lot more phone calls at the organization? Do you find than before?
We have, and it's mainly because I think our caregivers, for our caregivers that are caring for their loved ones at home, most of the centers that were providing care for their loved ones and activity and care during the day have closed or have restricted the way they do things. And so it's harder for them because now they have their loved one in their house 24/7, right? They don't have that time of relief. They don't have that break. And so there are increased numbers for more caregiver support and programs that we have available. So we do have our wellness retreat for our caregiver, which we usually hold in person every year. And this year we are so grateful to be able to bring it in a virtual platform. And it is happening this week. And we have a Spanish session on November 18th, and everyone is welcome to participate. It is focused for our caregivers and their loved ones in the first stages of the disease. And it's just a day of relaxation. We will have music, we will have meditation, we will have a cooking demonstration, pet therapy, yoga. We are going to have a virtual tour of Italy. So it's just really a day where you can take a little break and enjoy it with your loved one. And so we encourage everyone to take advantage of that. To get more information, please call our helpline, which is 1-800-272-3900. But yes, more than ever, our caregivers are in need of support, are in need of help and education. So yes, we have had a great deal of calls.
What are some of the tips that you think could help, especially during the holidays, for the caregivers? Because, like you said, I mean, they're being affected tremendously, but also, what can they do for their loved ones that are going through dementia during the holidays? Do you have any suggestions?
Of course, the holidays are often filled, with sharing, laughter, and memories, but they could also bring a lot of stress, right? A lot of stress and a lot of sadness and sometimes disappointment because our caregivers, we're not only going through a pandemic and things are changing and we have to keep our circles smaller than before, perhaps, but they're also suffering the grief of loss, right? Because they're not able to celebrate with their loved ones like they did in the past. And so they have to modify the way they do things. And so our advice for our caregivers, or if you have a loved one and the holidays are arriving, we want you to get support. It could be at any time, day or night. If you are in need of advice, of support, or just any type of information and resource, no question is too big or too small. We want you to call our helpline. Once again, is 1-800-272-3900. And you can call us at any time of the day. We have our staff that's very knowledgeable and they can help you with stress relieving for caregiver responsibilities. There are support groups available as well, virtually or over the phone. So we invite everyone to take advantage of these resources. And of course, we're celebrating observing physical distance, right? So we would like to continue our holiday traditions. Perhaps now we can drop off our favorite basket of baked goods or a care package and, avoid close contact, but being mindful of one another, right? Trying to find a schedule maybe on where we can do these little activities where we can still have that social contact in a distance and make sure that our caregivers are thought of and taken care of, right? So we want to make sure that they also take some time for themselves, even if it's 5 minutes for a walk or just mindful meditation. um, it's extremely important. And in order to care for someone else, you need to take care of yourself as well.
Yeah, this that is the biggest challenge. You have the tendency almost to forget about you. And ironically, the most important person at that moment is really the caregiver because they have to be able to be centered and have patience and not get sick. Because when you stress, I mean, you have the tendency of getting sick. And
Right.
you're very important for that person that is suffering from dementia. And I know, I tell you that my boyfriend's mom, she actually is in an assisted living and she suffers
Mm,
from a little dementia. But
okay.
right now, she wants to go home. Like they don't
Right.
want to be. Before they were able to get out and they were
Right.
able to take her to the house or take her away to a restaurant or away for the weekend. And not being able to do that, I mean, I see it and it saddens me because they're seeing that she's regressing a little because she doesn't want to be alone. And even when you go visit her, I went there with him and she wanted to hug us. She was like, I don't
Uh-huh.
care,
Yeah.
that. And to them, they're at a point that they're looking at their lives differently. Every moment
Right.
count, and not to be able to hug your loved ones, not to be able to support them and love them the way that you used to. It's painful. I mean, this is definitely today. But Jessica, the other thing that I want to ask you. You were talking before the show that there are some trendy food, vitamins, and dietary supplements that can help treat and prevent dementia. Can you elaborate on that?
Right. So there is a lot of talk these days, right? Especially in our world where we have social media and we see all this information that's coming at us with new trends about what vitamins and what supplements and what foods to eat, especially because they're promoting memory and focus. And some of them even advertise curing Alzheimer's, right? And so it would be wonderful. It would be wonderful if a particular food or supplement existed that could delay or prevent Alzheimer's disease or even stop the progression of the disease. Sorry, that's my pup agrees with everything. However, unfortunately, there is no scientific evidence behind all these supplements, right? And so what we usually say to our caregivers is that you don't need to be a researcher or a scientist to think like one, right? So we want to be educated consumers and make sure that we do a thorough research for any vitamin, any supplement that you want to take or begin implementing in your diet. We invite you to and we encourage you to visit the FDA website where you can find a list of all the supplements that have a warning citation, right, that have been promoting the cure for Alzheimer's or improving memory. And so the Alzheimer's Association is really taking a lead on this and working with the FDA to make sure that really, things that are out there are really not working for people. So we want to be educated consumers. There is no single recipe right now to cure Alzheimer's. There is a lot of research, however, on our lifestyle, right? They're really looking into our lifestyle choices, on our physical activity, on our nutrition, on our environment. And so, like I always say, a lot of people always want to, promote physical activity and nutrition changes because they want to look good, they want to look different, and because their physical appearance is important. However, it's good, but we also want to pay attention on the other reason why we want to take care of ourselves, and that's because having a healthy heart also means having a healthy brain, right? So we want to make these changes, and we want to be physically active and eat, change the way we see our nutrition. Are we socially active? Not only to look good, but to make sure that we have a healthy brain, which is extremely important.
I think, through now through Zoom, it is something that a lot of people are taking. It is important to stay connected because human connection, even if it's virtually, really is something good for the soul. And I do believe, what you're saying, taking care of your body. I mean, for me, working out, it's something that I always talk about. I've been doing it for so long, and I don't just do it, obviously, I look good. It's important,
You look
you
great.
feel good, and everything. But at the same
Right.
time, it is something that I say I always need for my brain, for my soul. It's the
Right.
happy, I always call it, it's the happy pill in a way. You
Right.
can you can avoid taking depression medication if you
Yes.
exercise, always. I mean, through the
Yes.
years of me having really going through many challenges,
Right.
focusing on exercise is something that is critical. But at the same time, also having connections, human connection, and even if it's just virtually, is something that we need to keep in mind, that the elderly, and especially people that have dementia, that they need to feel your love, even if it's virtual. You agree with
Yes.
me?
Absolutely, absolutely. Let's take advantage of the social platforms that are available to us, right? So if you have a loved one that lives in a facility and they're currently not accepting any visits or you're not able to see your loved one, reach out to that facility and see what other available options you have to keep that connection with your loved one. So you can utilize Zoom, perhaps you can utilize Skype or other virtual platforms to have that connection with your loved one, right? To maintain the relationship. Perhaps you can write a letter or send a card, right? So we want to make sure that we're doing that. And so reaching out to the facility to see what are your options is our recommendation. And of course, if you still live at home and you would like to connect with family members that perhaps live far, or due to the current situation where we really can gather with a large group of people and enjoy the holidays like we used to, we can also utilize our social platforms to gather with one another, because that social connection is important. Is important throughout. I think whether you have dementia or not, it's important to keep that live.
I remember, I think you were telling me about music and your dad, and how some people that actually have dementia, they can remember songs. And
Yeah,
would you suggest that, playing music for them uh, as much as possible
absolutely.
is a good idea, right?
Absolutely, absolutely. The music is not also therapeutic. I think it's just extremely powerful, right? It's extremely powerful because we all have that. We all have a song or a type of music that takes us to a specific time in our life where we felt happy or we felt sad or we felt however we felt, right? It's the memory that just doesn't leave you, right? So the power of music, I think that is even a form of non-invasive therapy, right? So when you have this available, I can, speak for my personal experience. When my father's disease was progressing, he really couldn't play guitar anymore, right? He had forgotten how to play guitar. However, when we would play a specific song, he would be able to recall some of the words and follow along, right? And so it was always a joy to see him kind of come to life once again and just really
Mm.
see him enjoy an activity. Although he was very unresponsive at the time and he had stopped speaking for a while, it was always a treat. It was a treat, and it was always a celebration to be able to witness that. And so, the power of music, I always say, don't underestimate the power of music, the power of art. Do a little digging, put your detective hat on and see what is it that your loved one enjoyed doing in their youth, right? Who were they before this disease? And that way we'll able to make that connection and just better the quality of life that they have while they're still with us.
Yeah, I agree. I mean, like I said, my mom suffered from Lewy body dementia, and we started to see, which is I think, one of the hardest dementia, because this dementia not only affects your brain, but your nervous system, right? I mean, it
Right.
affects a lot more, and they be aggressive, and, they have a lot of fear. And so it's extremely devastating to see your loved ones just deteriorate, mentally, physically, in every way. So the work you do is something that is so important, and the support you're giving the community right now, it's even more important during the pandemic, because people are alone, and a lot of people are going through this. The care givers, there, a lot of them, they don't have many people around. And even now with kids, like, you're trying to prevent the kids from being with their grandparents and all of that. What do you recommend that you do when you live in a household and you have children, and then you have also your elderly parents that are suffering from dementia? How do you protect them more from COVID?
Well, I believe it's just following the guidelines that the CDC has put for us. I think that we're all of us doing our part, keeping our circles small, right? And just really that's the only way to protect our loved ones. Wearing a mask when we go out, and really just reduce the time that we spend with other people that are really not in our circle. I think that's the best way to protect ourselves and protect our loved ones. Um, and sorry about that, but my pup is
We have a
restless
star
today.
there. Is that your
We
puppy?
have, yes, she's 10 months, but she's a handful.
It's a handful.
um, she sure is. But definitely, we want to make the best of it. I think that taking the necessary precautions and, of course, being mindful of one another and just keeping our circle small, I can't emphasize the importance of that. I think that's the best way that we can all just get to enjoy each other's company. And
Well,
hopefully this
Jessica,
will
thank
pass soon.
you. Yeah, thank you so much. We have to support each other. And what I love about doing these shows that, if there's 10 people out there out of the people that watch us today, that your advice, your tips could make a difference. So even just knowing that they have a place that they can call and get some guidance, get some support, just brainstorm on what you can do because it feels lonely and you don't have a lot of support, call the Alzheimer's Association and just ask questions. So thank you for the work you do in our community. I know you now for a while, actually, quite a
Yes,
few
it
years,
is,
and I
yeah.
know that you guys make a difference, and I know how passionate you are for the work you do because you experienced that with your dad, and that makes a difference. You want to help. So thank
It
you.
does, absolutely. We encourage anyone that may have a loved one that knows someone, maybe it's a friend, a neighbor that may need our resources. Please know you can call us at any time of the day. All our services are free. And so we really encourage the community to take advantage. We speak your language. We have help and support in over 200 languages. So please don't hesitate to call us. And if you need any services in Spanish, you can always reach out to me. I will be more than happy to help you out as well.
Well, we appreciate that. And we want to remind all of you that we are doing COVID testing. And because the spikes in the virus right now, we are available every single day. We're actually going to be extending our hours on the weekends. We have been extending the hours during the weekdays, and we are extremely busy, but we're here to support you. We are increasing the number of staff that we're bringing because you need us. And we know that. And we are here for you to help you. That is what Formé does because at Formé, our mission is your health. And we want to thank you for joining us today. We love you. Thank you for the support. And let's support each other and be good, be kind, and loving to each other. And remember that if you like the show, just give us a like. So I'm saying goodbye. Take care. Thank you, Henry, our producer, for all of your support every week. Take care. Bye bye. Thank you, Jessica.
Thank you. Bye bye.